So the Center for Memory Care is a new concept in trying to provide a single site where patients and their family members can avail themselves of a whole range of services that they'll need in caring for people who have memory disorders, including Alzheimer's disease. And there's 5 major components to the care center. There's the Diagnostic Clinic, which is a multi-specialty medical diagnosis area where patients will be tested by neuropsychologists, by physicians specialized in aging and memory function, by a geriatrician if we feel that that's an appropriate role. And out of that will come some type of information regarding their overall cognitive status, that is, where they stand at that point in time. In addition to the Diagnostic Clinic, we also have the Pfeiffer Pet Imaging Center. This is named after Eric Pfeiffer, who ran the Suncoast Gerontology and Alzheimer's Center for many years here at USF. And the PET scan permits us to actually detect the presence of material that builds up in the brain of Alzheimer patients years before they actually even get the disease. And this is something that we think will be very helpful to us in screening for Alzheimer's disease. We also have a caregiver education resource. And what this is a lending library and a virtual library that will provide information regarding many of the services that family members will need as an individual goes through the process of developing Alzheimer's disease. This includes issues like adult daycare facilities near where they live, caregiver support groups and where they're meeting and when they're meeting, elder law attorneys, and descriptions of the types of things that elder law attorneys can do to assist the family members. We also will have a partnership and research desk where all of the clinical studies that are presently ongoing can be explained to the patients and their family members. And if they wish to really help us in finding a cure for Alzheimer's disease, they'll have opportunities to do that there. And then finally, we have the Functional Assessments Facility. This is a place where we can do both physical therapy and occupational therapy screening evaluations. So we have a falls prevention facility where we can screen people for problems in gait and balance that may lead to an increased risk of falling. And if they show problems, we can refer them to the physical therapy school that's right next door to us. We'll have a driving simulator to help family members understand exactly where a particular individual stands with respect to their driving skills and whether they have sufficient skills to continue to be able to operate an automobile independently. We also have a small apartment, and in this apartment we can test activities of daily living. This is going to be very important in advising the caregivers as to what activities the patient is fully capable of performing independently and those which they're going to need assistance with. So we can test cooking, we can test dressing, we can test using restroom facilities, we can test a whole variety of typical daily skills and determine where they actually are going to need help as they go through their daily activities. These are the components of the care center that we feel are most important for patients and their family members. We also have a small classroom in the back where we can provide education for healthcare providers. We can provide education for first responders. We can provide caregiver support for family members who will avail themselves of these support groups. All of these things will go on here within the Institute. The other major component is the great room, and this is the part that we think also sets us apart in that this is intended to be a comforting, relaxing environment rather than your traditional medical office waiting room area. This is a place that really wants to make you feel like you're at home because we believe some of these folks may be here for half a day, and we want them to feel relaxed and comfortable while they're here. So those are all the major components that we have.